Okay, the meeting has been recorded. So panelist one, you may start the presentation. Okay, but before that, give me a heads up. What is your group's panel discussion title? Okay, because Hadif is not here. Okay, just tell me the title and proceed with your points. After that, we will continue with the rest of the panelists. Okay, Neha?
Okay, miss. But I think still IRDINA is not here yet.
This is an individual presentation, so I believe there is no problem with that. Okay?
Hello. Sorry,
Hello.
miss.
Okay. Okay, panelist one, you may start.
Um, all right. So a very good morning to Miss Naziha and my fellow members. Today, our topic is silent killers, how NCDs are taking lives without making headlines. So first of all, I would like to talk about my point of view about this PTSD. So post-traumatic stress disorder, PTSD, is a mental health condition that can develop after exposure to traumatic events like violence, incidents, war, disaster, characterized by symptoms such as flashbacks or any traumatic emotional related events. So while PTSD is often associated with military combat, research shows it affects diverse population, while studies indicating up to 50% of sexual assault survivors and 40% of refugees develop the condition uh, in this PTSD case. So this is stated by the National Institute of Mental Health by 2023. So let's just have a look from two different type of perspective on two different type of lifestyle. So person A is having a normal lifestyle, is having a normal childhood, is having a good community, whereby person B is having a bad traumatic childhood. The way they grew up is where they have like a very bad community, they have traumas, they have family issues, they have friends with a very bad influence. So in this situation, we can see that this leads to another person's, we can see the other side of it, where it will actually make them to cause harm to themselves. This person will be quiet, timid all the way, triggering sensitively to the results can be disastrous. I said it disastrous, it is because it can be verbal or physical, depends on the condition. Now, in addition, post symptoms emotionally traumatically affected members injured severely or died in the past will face difficulties in overcoming that situation. So let's just say in person's B's past life, they have this incidents where they lost someone who they loved. So that will eventually have an effect on their life itself. So losing a fellow member in a specific squad, let's just say in a war squad, so they will have a very tough time to to let their emotions to overcome what they're going through right now, and this would also lead them to physically disorder, whereby post uh, war veteran soldiers will undergo this problem. So let's just rewind our memory to the most dreadful news that happened recently in 2024, where 10 Royal Malaysian Air Force personnel were killed during a rehearsal for a military parade of a air show. This incident was filmed live and was being watched by bystanders and top military officers. The footage was carried exclusively over the board for the next 48 hours, and upon watching the incident in the TV screen, many had PTSD. Why I said it so? It is because they will think, what about the immediate family members? I'm sure they have deeply affected emotionally and traumatically, the wound will be there permanently. The post symptoms are related to emotions. This makes people terrified to watch the next aircraft shows or the next any aircraft related rehearsal. Like recently they have it in Langkawi, like Lima 2025. So this scenario can be avoided if one of the helicopters is being handled carefully in the air. So personally, I would like to summarize this episode as a simple human negligence which can be avoided. So that's all from me. Thank you.
Okay, but before that, Neha, what about your text justification? Can you tell me the source of your points and tell me the reasons why you refer to that text?
Okay, so the source of the point is from the National Institute of Mental Health, where I took the percentage of sexual assault survivors and the refugees developed in the condition. I took this specific reference because it relates to how PTSD affects their life. And then the second one is I took the evidence that recently happened last year is the aircraft crash while doing the rehearsal.
Okay, thank you, Neha. Okay, now moving on to panelist number 2.
Okay. Another research about epidemiological trends and risk factors of PTSD is in parents of critically ill children in 2023 discovered the factors of PTSD in parents. The first factor is parents of children with more severe illness often experience greater internal worry and fear. In cases where the child's condition is particularly severe, parents often encounter heightened inner turmoil and fear. The efficacy of healthcare professionals' communication skills directly influences parents' comprehension of their child's illness, making it imperative to engage in dialogue with parents to assuage their worries and anxieties. In the study conducted by Len et al., parents were taught cognitive behavioral strategies, emotional awareness, and emotional regulation to improve their parenting approach so that they can better support their children. However, these interventions failed to take into consideration the mental and emotional health of these caregivers and focused on short-term outcomes rather than longitudinal changes in desired child behavioral and mental problems. In conclusion, parents can develop PTSD when they experience ongoing anxiety about their children's health, constant worry, medical uncertainty, and fear of losing their child can create deep emotional stress. This stress can become traumatic, leading to symptoms of PTSD and affecting the parent's mental well-being. Moreover, the factor of PTSD in parents increases when they face economic strain resulting from unemployment. The reasons are when the parents lose incomes, it can lead to housing instability, food insecurity, and inability to meet basic needs. The constant worry about finances triggers chronic stress, which can contribute to or worsen PTSD symptoms. In addition, parents may feel grief or anxiety about not being able to provide for their children, which this stress can be traumatizing, especially if they are forced to make difficult decisions such as pulling kids out of school, skipping meals, and not providing the best treatment for their children's illnesses. In the investigation conducted by Macedo et al., the doubly robust estimator IPWRA indicates that when a young man belongs to a family without a child, this decreases his salary by approximately 2.2%. According to entropy balancing, the decrease is actually greater, approximately 4.2%. This decline in wages can be partly attributed to social pressure and the enduring influence of traditional expectations surrounding the main goal. The conventional provider role may contribute to heightened levels of anxiety and stress, influencing job performance and consequently resulting in a decrease in salary. This shows that when parents lose their jobs, they may face stress from financial problems, worry about their family worry about their family's future, and feelings of failure. This pressure can be overwhelmed, especially when they struggle to meet their children's needs. Over time, this stress can lead to serious mental health issues like PTSD, showing how job loss in parents can deeply affect both their well-being and their family's stability. I chose this academic article because it related to our discussion of Sustainable Development Goals 3, SDG 3, good health and well-being, which focused on PTSD. This article was published on 2023 by the researchers who are primarily based in the Department of Epidemi- Epidemiology and Health Statistics at the School of Public Health, Zuni Medical University. Their work often focuses on trauma, stress disorders, and public health intervention. That's all from me. Thank you.
Okay, thank you, panelist 2. Now let's move on to panelist 3.
So I'm going to talk about the effect of PTSD toward an individual. According to DSM-5, or the statistic of mental disorder, individual who happen to have PTSD usually doesn't have a specific symptom. They might show different symptoms such as behavior change, dissociative episode, or combination of both symptom pattern. This symptom typically usually lasts around 1 month and can cause significant distress and problem in someone's social life and social setting. Another important thing to note that children and teenagers may experience this symptom more differently than adults. Children usually under the age of 6 will typically have more of a regression of speech and also acting out in their time, while teenagers usually were more acting out by being aggressive or disruptive. In DSM-5 also demonstrate that PTSD have associated with suicide ideation and the presence of PTSD in individual increase the likelihood of that suicidal ideation to progress to suicidal plan or attempts. This is a few effect or and symptom that someone may exhibit if they have this. That's all for me.
Okay, what about text justification, Shazwani? Where did you get the points from?
I use DSM-5, which is a book that were used by psychologists to diagnose someone with mental disorder, and it was the latest revision, which is the 5th revision that was published in 2022. And also I used the information from the National Institute of Mental Health, which was revised in 2023.
Okay, thank you. Let's move on to the last panelist.
Okay. First of all, I'm so sorry, Miss. I have problem with my background. Okay. Good morning, everyone. I'm IRDINA, and today I will be discussing solutions for PTSD as part of our panel on silent killers, how NCDs are taking lives without making headlines. Firstly, post-traumatic stress disorder, or PTSD, is a serious mental health condition, but fortunately, effective treatments are available. According to the World Health Organization, 2 of the most recommended therapies are cognitive behavioral therapy, CBT, and eye movement desensitization and reprocessing EMDR. So what are they? CBT helps individuals manage PTSD by identifying and changing negative thought patterns and behaviors. For example, someone who avoids reminders of a traumatic event may learn healthier coping strategies and ways to safely face those triggers. On the other hand, EMDR involves a therapist guiding the patient to recall traumatic memories while following hand movements or other visual cues like flashing lights. This process helps the brain reprocess the memory so it feels less intense over time. Moreover, these treatments can be delivered individually or in groups, either face-to-face or online, making them accessible to different people and settings. However, the therapy alone isn't enough. Self-care also plays a major role in recovery. For example, the WHO recommends maintaining daily routines, talking to trusted people when they are ready, avoiding alcohol and drugs, staying physically active, getting enough sleep, and learning stress relief techniques like deep breathing and muscle relaxation. These habits are simple but powerful in helping individuals manage PTSD symptoms over time, according to the WHO. Furthermore, recent research supports these approaches. A 2023 meta-analysis by OA confirmed that CBT is highly effective for treating PTSD in real clinical settings. In addition, a 2021 study by Unitree showed that both CBT and EMDR significantly reduce PTSD, anxiety, and depression symptoms, especially among vulnerable populations. In conclusion, by combining professional therapy with practical self-care, people living with PTSD have real hope for recovery. Lastly, I chose these sources because they are credible, recent, and offer practical, adaptable solutions. This fits directly into our panel discussions on non-communicable diseases and SDG3 good health and well-being by showing that mental health care is not only necessary, but it is effective. Thank you, Miss. I think that would be the end of our discussion today.
Okay, thank you, Group 6, for the presentation. Overall, the points that you have gathered are all good. Okay, they are coherent across all group members. I can see clear direction for each of you because you have a clear discussion aspects and the points reflect that. So good job on that. Okay, just have a couple of comments. Number one, just would like to and confirm with you again. Okay, the panel discussion title is on silent killers, how NCDs are taking lives without making headlines. But the points or the discussion aspects, they are more focused on one NCD, which is on PTSD, right?
Correct.
So I would suggest you to change up on the discussion title, make it more specific to PTSD, which is the focus of the discussion itself. Okay, so that is on the title. Next is on verbal citation. Especially for SHAFWA, panelist number 3. Okay, make sure to verbally cite your source of information as you include the evidence in the presentation. Okay, so if you have 2 points, then 2 times of verbally citing the source. Okay, so when doing that, mention the author's name and the year of publication. Because if you do not do that, then I will not know that, okay, this part is actually the evidence to support the points. Okay, if I don't know that, then I will have to assume that all of your points, they are simply your opinions. They are not supported with evidence from reliable sources. Okay, understand or not? Panelist 3. Okay, so I believe that is all. With regards to my comments, your points are all good, supported with evidence, so all good. Do you have any question for me before we dismiss?
We are so sorry for the technical problem.
No worries. Okay. Any other question?
So this recording, we just post on YouTube and the link
To
submit
be
at UK for you.
submitted. Yes, correct.
So for the
Okay.
oral report,
Okay, this is the oral report. Okay, it is a report in the form of an oral presentation. So you don't need to come up with any write-up or separate report after this. Okay?
Right, alright. So
Okay,
for
Miss.
Hadif,
Yes?
Hadif will submit sendiri. So kami submit jugalah.
Yes. Okay, so for the four of you, you submit this link. Okay, but for Hadif, he will send a separate link because he'll be doing it individual presentation. Okay.
Okay.
All right, that is all. If you don't have further question, please don't forget to submit the YouTube link by midnight today, and don't forget to come to class next week. Okay.
Okay.
All right, that's all. Thank you, Group 6. Have a good day.
Okay, thank you.
Thank you, May.
Welcome.
Miss.
Wait.